If you want to learn how dementia does not have to be an illness where the doctor tells you, you have dementia, it's bad, you're going to go home and wait to die. That literally is something a doctor told one of our clients recently. And there's nothing that we can do about it. If you know that the narrative doesn't have to be that anymore and you want to learn more about that, then this video is for you, because there are ways that we can help people with dementia have better cognition and function better. And they've even seen increased MoCA scores with these interventions. Welcome to Creative Connections in Dementia Care, and today I am talking with Dr. Heather Sandison about her new book, Reversing Alzheimer's, which I'm very excited about. I've been following her for a long time, and I am a brain health coach, and I know how much these things work for so many people to have a better quality of life with dementia. And you're going to learn how all of us at any age can start living a brain healthy lifestyle to decrease our risk of dementia. It's going to be a really great conversation, and I can't wait for you all to meet Dr. Heather Sandison. So welcome, Dr. Sandison. We're so excited to have you here today to talk about your new book, Reversing Alzheimer's.
Thanks for having me.
I'm so excited because, as a brain health coach, but also as a dementia care specialist, most of us are told there's nothing we can do for our loved ones, not only in terms of like everyday care, but that somebody could actually maybe function better, maybe they could have a better quality of life. And you've been doing this with your clients at Marama and had amazing results. And I know you published your paper last year, and it's been so great to see your journey and what you've been doing with all of your clients. And then there's many ways you've made it accessible for us, but now you have, the book coming out, and I'm so excited to talk to you about it and kind of how you got there and kind of some of the things that you have found in your research and in working with people.
Yeah, it's been such a fun process. I was telling someone earlier this week, like my favorite words here are, I got my mom back, right?
Yeah.
And we hear this with, it's not every day, but with some regularity, every 6 months or so, somebody's like, wow, it worked. My
Yeah.
mom is different. She's back. She's herself again. Or my dad, or whoever it is. And I think I hope that you celebrated the way I did. Just this past week, CNN came out with a docuseries.
I
Sanjay
know.
Gupta had this docuseries showing that Alzheimer's is reversible. And I think it's easier for people to grasp that it's preventable when we can see someone reverse the disease process, when we can see them regain cognition. And Sanjay Gupta was documenting stories from the West Coast, Dean Ornish's patients, and then someone from the East Coast who was Richard Isaacson's patient. And this is really exciting for me because finally this concept that you can reverse dementia, it's going mainstream,
I'm so
right? And
excited.
it's
Yeah.
finally, right? Because I've been watching this, you've probably been watching this. I've seen
Yeah.
this for almost a decade now. And it's really hard and sad when people are being told that there's nothing you can do, because that gets programmed and then they feel
Yeah.
hopeless and they feel helpless, and then they're not willing to put in the effort to get better, when it's very clear to me that if you are willing, and it's not going to be for everyone, but
Right.
for those who are willing to put in the time, the effort, some resources towards regaining their cognitive function, this is possible and very worthwhile.
Yeah. I know. I'm so excited because you're right. It's been a long time. Like when my mom was diagnosed in 2009, because I like to research things, I went and researched all the things. And back then it was like, kind of like the early um, ideas of like the keto diet and things. And they were still kind of, working on stuff. But, it was like, don't try anything with your mom. It's not going to make any difference. And we didn't. I wasn't the main caregiver, but for me, I was also at the time where I had lost 30% of my cognition from some medications that I was taking, and they said it would be permanent. And I was like, well, what if I just do this thing? I know N=1 is not a, research study, but I've been implementing these things over the years. And as you all have like solidified it more and seen what's really happened with people, and my cognition is so much better and I can do things again that I couldn't do before. And as somebody, not only that, but living with mental illness and told that also would never get better, that it was untreatable, because I had treatment resistant bipolar. But to have a life that I never had before, I know that people, it doesn't sound real to them. A lot of it is because the stuff hasn't reached mainstream media. So when we talk about it, it's like, it just isn't believable. And so I was so excited to see that. And that's why I'm so glad also that you're book is coming out because I think it's really going to help people see how to do it in an accessible way. And I love that you talk about what is doable for you, you know, because I think people kind of panic when they see everything.
It can feel really overwhelming, and I think that that's part of this issue, right? Is like
Yeah.
it's black or white. It's like there's either nothing you can do, and that should be criminal to even tell people anymore
Yes.
because it's almost overwhelming how much we can do. And one of the things to reassure people around that overwhelm is when we did our clinical trial, we recruited 23 participants. Well, we recruited 35 and
Yeah.
23. So this is pretty normal for an Alzheimer's study. About 30% withdrew for one reason or another.
Yeah.
But 23 of them were able to go through our 6-month intervention. And 17 of those, or 17 of the 23, or 74%, improved their cognition measurably. So they all started with mild cognitive impairment, and some even diagnosed Alzheimer's. So MoCA scores of the Montreal Cognitive Assessment scores between 12 and 23.
Yeah.
And 70, so this was measurable cognitive impairment, not normal cognition. They didn't just have that subjective, my brain's not working as well,
Yep.
but actually measurable. So, of those 17 people who got better, no one did everything.
Yeah. It's
They
amazing.
all did something. They all were willing to do something. They all changed their diet at some level. And some people got into ketosis. They all started exercising differently. They all did something, but nobody did absolutely everything. So, to improve your cognitive function, to get on this path, it's really just a matter of starting, of taking
Yeah.
that first step, of doing something. And then the hope is that if what you do is prioritize sleep or get that sleep study and start wearing the CPAP,
Yeah.
if you can get better sleep, then now you have better energy in the next morning. So you make better dietary decisions and you have the energy to exercise. And you start getting this like spiraling up process where
Yeah.
your lifestyle is improving and then your cellular function, your neurological function starts to improve with it.
Yeah. It does make a huge difference just to try one thing. Like my thing for me, typically that I look at first is the sleep because you're so right. I mean, your cognition decreases when you lose even just an hour of sleep. But then, I can't make food decisions. I can't even figure out what I want to eat. I'm like, I can't today at all. I've had clients with dementia who, have really bad sundowning and things. And I'm like, how about if we just look at their sleep? And then improve their sleep, and then sundowning, they're not having all those symptoms and things like that. Somebody's MoCA scores actually went back up after she was living in a memory care facility, and she didn't want to wear her CPAP, and they were like, well, we do person-centered care, so we're not going to have her wear it, which I understand that theory. And I was like, well, can we look at maybe why isn't she wearing it? Right. Because that's in with Montessori care, that's what we do. Like, why is something happening? And see if we can find a way for her to wear it again. And so she did start wearing it again because we changed the routine and procedure for her wearing it. And then her MoCA score went back up to what it was before she stopped wearing it. And, the family was just told, well, her dementia got worse and it's going to be a decline. And so, you know, it's so important that people think about, and you have in the book, like how to think about what might be the first thing for you to start with, which I thought was really great. Are there certain things that you typically, if you were like, well, maybe if there were some things you were going to look at for most people, what might be the first like two or three things that you would suggest somebody look at?
Yeah, so foundationally, diet, exercise, sleep, and stress
Yeah.
management are they're foundations, right? So like if we can make changes there, we start to get a lot of traction, right? So what I typically suggest to people is everyone's going to be a little bit different. But for you, what's going to be easiest? And then what's going to make the biggest difference? And I'll talk through some examples here. So sometimes social isolation leads to
Mm,
increase in stress. So maybe getting more stress management capability, more capacity to tolerate stress. If you're already going to church and there's a Bible study that's available on Tuesday and Thursday, and your neighbor already goes, all you have to do is just coordinate jumping in the car with them.
yeah.
Do that because that's pretty easy, right? You already like there's just this minor tweak. Maybe you're already flossing your teeth and brushing your teeth, but you haven't made that dentist appointment. So like you have pretty good dental hygiene, but you're not doing that. Like there's one little piece and like your dentist's already been calling and wants to
Yeah.
schedule because you're on the list. But like there's this one thing that's pretty simple and pretty easy. You're familiar with it. It won't take a lot. Do it. make the move. Go ahead and put it on the list, cross it off the list, get it
Yep.
done. Because then that feels like a win. It's like, all right, I did something good for my brain health. And then sometimes that can lead to the motivation to do the next thing. And then the other direction, and you can choose one or both of these, right? Like it
Yeah.
doesn't, they're not mutually exclusive. But the other place to go is like that big thing that you've probably been thinking about. You already know you've been sedentary for a long time. Like since
Yeah.
retirement, you haven't gotten into a good exercise routine, or your diet, is not the best brain healthy diet, but it's going to take a big lift. It's going to be a big shift. But once you make the shift, we're expecting pretty big benefits, right? Like it's really going to help. Maybe it is wearing that CPAP. Like that feels like a lot of effort, but
Yeah.
you've got it and you just have to commit. Like I am someone who wears my CPAP.
Hmm.
And doing that will give you that really big delta, that big change. So those are two places where it's like if I can encourage people to like just get started, get that small win that they're like that win, just that win that's
Yep.
like relatively easy to get, or get that big shift and like change your identity around who you are and what you're prioritizing and how you're going to live life, and just start with one of them. Like, don't make it sleep and diet and exercise and
Yep.
a brand new meditation
Mhm.
practice, right? Like, just pick one thing and then feel the benefits and use that. It's like when we wake up more rested, like use that. Like when we start eating better, often people's mood improves, their
Right.
cognition improves, their sleep improves, they have better energy. And so get that benefit and then start layering all the other pieces when it's less overwhelming.
Yeah. That is really important advice because I think people want to go all in, or they think they have to go all in. It's very overwhelming and can be scary. So,
And if you feel
um,
like going all in and you've got support, by all means, dive in.
right.
But
There's personality, like my husband's like that. He's like, I did all the things and I changed it all in one day. Because there's personality types where that works, right? Yeah.
yeah,
And then for others of us,
the
we
rest of
do,
us.
yeah, do the other steps, which is also a great way to get started. And you do start to see, improvements right
Yeah, you
away.
do. And I think finding community in this is also something that's really helpful, right?
Right.
Because the conventional narrative still is that there's nothing you can do. And often if you're going to your neurologist or your primary care provider or your physical therapist even, or whoever it is out in the community who you're interacting with, they're often not expecting you to get better.
Right.
And so it's almost like an uphill battle to like convince people, no, I can, and give me the help that I need and
Yeah.
support me so that I can, or my loved one. And that can feel like, yeah, just like this constant battle. It's like effort and energy that goes into kind of changing people's perspectives.
Yeah.
And some people experience like a homecoming when you're surrounded by other people who see the world in this way, that there is possibility for recovery, that there is possibility and space for hope. And so being around, whether it's on Zoom or
Right.
other venues, to surround yourself with people who are, or maybe just on Facebook or
Mhm.
whatever the community venue is for you, knowing that there's other people out there doing this, seeing the
Yeah.
benefits, getting this experience, bumping into the hurdles and needing to figure it out again and adjust and adapt, all of that is really normal. And so being around people who can support you along the way and share this enthusiasm, I think is important.
Yeah. It does make such a big difference, to make big changes and not have to do it alone and, have somebody around when you might go out. Sometimes I see a lot of times people are like, oh, well, you can just, you don't have to go to sleep at this time. Or like for me, it's bad. If I don't sleep, like it's not good. And they're like, oh, you can just stay up one night. And I'm like, well, actually, most of the time, I mean, unless I have like some performance or something, I actually can't. Right. So, being with the people, it makes a huge difference to kind of have that support system and everything
Yeah,
for,
where you all prioritize
yeah.
similar things, right? So it's not like, oh, really? You're not going to have the cake and ice cream for somebody's birthday and you're getting guilt tripped about not doing that, or you're not going to have a drink with me when I
Yeah.
like need you to have a drink with me. It's like, no, I having those, not feeling like the need to create those boundaries, but actually being
Right.
surrounded by people who are going to be like, all right, let's have a Thanksgiving meal that's really healthy and not give each other sugar and alcohol as gifts.
Yeah. I had when my son's been gluten free for a long time because he's got some autoimmune stuff. And when he was little, another parent made him a gluten, like a real cake, like a cake, even though he's gluten free,
A
because
glutinous cake.
yeah, she felt like it was not okay the way we were having him eat, and he was missing out on all this stuff. And I was like, that would just make him sick. But like, it's amazing our emotions and all that kind of stuff around food and stuff. And so, having people um, to work on that with is really helpful when you're kind of going outside the traditional norm. So that's,
Yeah, not having to feel like you're fighting.
yeah, definitely.
Yeah, it's nice.
What has been a more surprising, um, reversal or improvement that you've seen in some of your clients?
Yeah, they still kind of surprise me. I think,
Mhm.
maybe not surprise me. That's not true anymore. Of course,
That's
at
true.
first,
Yeah.
like my first patient who I saw get really significantly better, I was, in tears, just like, oh my gosh, like if this is possible, all of the suffering that could be
Mhm.
avoided. And now I still have a reverence. I still have just a deep appreciation for the amount of effort my patients and their family members put into get their recovery and watching them get better
Mhm.
and doing everything that it takes. I, uh, I yeah, the surprising stories. I think one of the most recent and inspiring stories, we had a woman who moved into Marama last fall, and she moved in on her birthday. It was her birthday gift to
Aw.
herself to move in, and she had a MoCA score of 24. So she
Mhm.
was, it was starting to be measurable cognitive impairment, but not
Yeah.
severe by any stretch. And she moved home 6 months later with a MoCA score of 30.
Oh my gosh.
And that is like, I wish that my hope for the future is that that's kind of how memory care
Oh, yeah.
looks is like it's about memory recovery. You go if you're starting to notice
Mhm.
changes, if we're starting to measure changes, you go do an intensive program and then you're at a place where cognitively you have the ability to learn how to take these tools home with you and
Yeah.
apply them at home. And then you get to return to independent living and that you go back to being around your grandkids and your neighbors and you go back to your own church and you go back to your life
Yeah.
but with full cognitive capacity and the tools to maintain it.
Yeah.
And so I guess I'm oriented kind of in that direction right now and excited about it because we got to watch kind of the first person return home
Yeah.
with a perfect MoCA score.
That's amazing. And that would be such a better, kind of idea of memory care than, what we have now.
Yeah, memory
Um,
recovery instead of
yeah.
memory care, where the
Yeah.
expectation is that people just go downhill with memory
Right.
care. Like you mentioned, the
Yeah.
family was told to just expect her to go downhill. There's no explanation for it other than her disease.
Yep.
And so don't expect her to get better. And then lo and behold, get her airway open at night and
I
she gets
know.
oxygen to her brain. And it's like, oh,
Yep.
there she is.
Yeah. Well,
Yeah.
and that's the thing. I think sometimes people don't know what it means, either reversal or even improvement. Like, a MoCA score of what you said, she had 24, right? I would say even when my dad, was around there because he has Alzheimer's now, there were significant impairments to his everyday life, right? He wasn't able to do public speeches like he used to, or we had started a nonprofit together that he was still running, and he's like, I can't do this anymore. And, that's a huge impairment for someone's quality of life. And to be able to get all of that back, I don't know that people always understand what it means to get functioning back, I guess.
Yeah, and it's also there's a lot of fear,
Hmm.
right? When you see is when you can fully understand, and particularly your dad probably saw your mom go through the
Yeah.
process and
Hmm.
has seen other people, family members go through that long goodbye that is
Yeah.
Alzheimer's. And the thought of becoming the patient after being the caregiver, right? The thought that, like, I'm going to go down that path and there might not be anything I can do about it is terrifying,
Yeah.
right? There is terror
Hmm.
around that. And that just adds to that feeling of overwhelm.
Yeah.
And so the hope is empowerment, right? It's like,
Yep.
all right, let's take control of this. Let's turn it around, especially at this earlier stage where we can, and
Yeah.
we get that person's like real participation. They're motivated and they're
Yeah.
excited to do it. Yeah, it's exciting to think about how much this disease can change right now.
Right.
We have the tools. There's not enough research. I don't know that there ever will be,
I know.
but we do not have to wait for some miraculous single molecule intervention like a pharmaceutical. We can do
Right.
it now. We have the tools. We have enough data. The side effects of these interventions are that you know, your blood sugar improves and your
Yeah.
hypertension improves and your sleep improves and, you know,
You have to
health
cook more,
improves.
but
Yeah, you might have to you gotta cook more and you gotta, like, spend more time working, engaging physically,
right.
and cognitively. It does take work, and it won't be for everyone, but it's
Right.
possible.
When you were, I guess, coach for us in our membership, I think you talked about somebody who had a really low MoCA score, and she was very limited in her ability to speak, and then was able to gained a lot of that, like her speech ability back,
Mhm.
some of it.
Yeah, yeah, we see
Yeah.
that pretty regularly. Um, yeah, so I mean, my first patient kind of that I saw who had significant cognitive decline, her husband much more enthusiastic and confident in the program than I was at that stage because I had
Yeah.
just been trained by Dr. Bredesen. She came in with a MoCA score of 2, and she was only able to answer questions with a yes or no.
Hmm.
And very debilitated, completely dependent on her husband. She had this, like, big, bright, bubbly personality underneath. She'd been a school teacher, and she was had cut dressed really colorfully, and she had this, like, leather-studded black bag, and she still dressed herself. That was something really important to her. She would
Yeah.
have, like, fashion shows for her husband and like, was, like, engaging in that way, and you could see her personality behind sort of this like her almost like an eraser was like erasing
Yeah.
parts of her brain, but like there was this piece that was still there and it was so big and bold and bright and beautiful. And she came back 6 weeks later, and they did everything, right? Because he was
Wow.
enthusiastic and they were
Yeah.
desperate. And so they moved out of a moldy bedroom. They actually moved into the living room in their house.
Hmm.
They got on keto. She got on bioidentical hormone replacement. She got all of her dental work done. They started ballroom dancing 3 times a week. Like
I love that.
they dove in fully. Like he was not one of these people that was like, okay, let me try the easy thing and
Yeah.
the big thing. It's like, no,
All
everything.
the
Give it
things.
all to me today and I will do it tomorrow. And sure enough, her MoCA score was a 7 when she came back. So it had gone up by
Yeah.
5 points
My
in that,
gosh.
like a little bit more than that many weeks. And she was speaking in full sentences. Their experience of life had changed dramatically. Now, she
Yeah.
wasn't able to go back to work, right?
Hmm.
She wasn't 100% better, but this was only 6 weeks in.
Yeah.
So, and when like what's possible for people, I've only been doing this work since 2017. It hasn't even it's been what, 8, 7 years, 6
Yeah.
years. And so it's like we don't even know what is possible for people who do this. Dr. Bredesen is publishing a paper on people who have been on the program for 10 years.
Oh, that's
He
great.
published his papers, started publishing them in 2013, 2014, and people were reaching out to him right away about how do I
Hmm.
do this? And there are people who started then who recovered their cognition. Patient zero, he refers to in his books, and she worked for this FBI or the CIA or something, and so was very cautious about letting people know who she was. That's why
Right.
we call her Patient Zero.
Yeah.
Well, she's since retired from there and has become a brain coach. So
Oh my
she
gosh.
now helps and supports people who are trying to do what she's been doing for the
Hmm.
past 10 years. She's cognitively sharp, totally with it. And she is now able to support other people with cognitive decline. And I just think that this is so amazing. I mean, part of the things that has given me some confidence with treating people with Alzheimer's is like, you would never want a doctor who had Alzheimer's, right? Like
Yeah.
that would just be crazy. Whereas a lot of, rheumatologists, maybe they themselves struggled with an autoimmune condition or there are oncologists who are like, okay, I went through having cancer or
Right.
ER doctors, like I've been in the ER as a patient. And yet, with Alzheimer's, it's like you would never see a provider who had Alzheimer's. And now here it is,
Yep.
patient zero, who started with Dr. Bredesen back in 2014, 10 years later, is sharper than she was then, has maintained her cognitive momentum and abilities. And now she has transformed her experience into supporting and helping others. I think that's just like the coolest thing ever.
That is the coolest thing ever. That is amazing. And yeah, I mean, and just the way she's going to be able to connect with who she's helping
Yeah.
too, right? To have gone through, the same program and everything. And
She
that
can
is,
relate on a
I
totally
know.
different level.
Yeah. It
Yeah.
is weird. People who don't have any brain stuff going on, I'm never quite sure how to explain what it's like to go from living your life like in a fog and then not anymore. Or you know what I mean? It's like it's
Right,
hard for
like
people
you
to understand. Yeah.
absolutely, you've had this experience, and you've
Mhm.
also had the experience of caregiving.
Yeah.
I don't think I could do my work if I was caring for a loved one with dementia. Like, I have a five-year-old, and that's a lot in and of
Oh,
itself, but the experience of caring for someone with dementia who's had a driver's license, who's been independent,
right.
who is large, right? Like, just physically,
Yeah.
they're big. Like, my daughter, I can pick her up and put her in bed and kinda,
Yeah.
you
You
know,
can do
and she isn't like, "Oh, I need to go to the grocery store, and I
right.
I know where the
Like
keys
right
are."
now, I need to go.
Yeah. It's such a different experience, and I know that she's gonna gain more independence over time, whereas
Right.
with the long goodbye that is Alzheimer's, there's so much unpredictability. Like, what are they gonna lose next?
Yeah.
What is this gonna be like in 3 years or 5 years? Is it just gonna be worse? Is it gonna be the same? Are they gonna be gone? Like,
Right.
there's so much that you don't know, and it's really hard to prepare and plan emotionally, financially, logistically, and so I really appreciate that you show up in this way, having that ability to relate to all of those families going through this.
We hope that we can help families and give them, like what we didn't have with my mom. But then, now it's 14 years later and my dad has Alzheimer's and still we get all these messages like, I was never taught this stuff, even like CNAs, like I have been working as a CNA for 8 years and I didn't know any of this stuff. Um, in terms of just the care part. And then the
Mhm.
brain health part is fascinating. Like one of the things I love that you talk about is dual tasking. And like with Montessori, we do a lot of dual tasking. I don't like usually call it out like that, but honestly, that's we do a lot of
Yeah.
it. I was wondering if you could talk about that a little bit.
Yeah, well, just movement and exercise in particular, right? Like, generally, what are we getting from this? We're getting blood flow to the brain. This
Yeah.
is a matter of plumbing, right? Like,
Yeah.
if we don't deliver, it's like if your pipes are clogged because of atherosclerosis, or or if you have obstructive sleep apnea, so you
Yeah.
can't get oxygen into your lungs, and then you can't deliver it to your brain. If you have airway obstruction or vascular obstruction and you cannot get blood to your brain, we have a problem. Your brain
Yeah.
is going to degenerate. It's not getting the resources, it's not getting the nutrients, it's not getting the energy it needs. And then you're probably also not getting rid of the toxins. Every cell is going to have metabolic waste every day that it
Yeah.
needs to get rid of. So we need blood flowing in and blood flowing out. And if we're sedentary, we're not going to maximize this. We're not going to utilize what it takes to get that heart rate up, to get that blood pressure up temporarily while we are pumping oxygen and nutrients to the brain and out of the brain. So just getting that blood flow from exercise is so crucially important. Now, aerobic exercise, of course, is going to help that pumper, right? Like, it's
Right.
going to help the heart. It's aerobic exercise, it's cardio, right?
Yeah.
Cardio to help the heart, but it's helping the brain just as much because we're pumping that extra blood, but also because it's helping us to modulate blood pressure, modulate the atherosclerosis and all of our risk factors when it comes to cardiovascular disease that affect the brain just as much as the heart.
Yeah.
And then strength training. Strength training is the other one that, of course, most people
I
are
know.
familiar with, but it's building muscle.
Yeah.
And building muscle is so important to brain health because there are signals that come from muscle. We think that we call them now, when I was in training, we called muscle connective tissue,
Mhm.
and it was in that category. But now we think of them more as almost endocrine tissue that are actually, that muscles are creating exerkines, which, we've talked about. You've probably heard about cytokines through
Yeah.
the COVID world,
Yeah.
and we think of these as bad. They're like inflammatory, but exerkines are good. They actually send signals to the brain that tell our brain, things like BDNF, brain derived neurotrophic
Mhm.
factor, to build new neurons, build new
Yeah.
connections between them. So both types of exercise are important. Now, the one that you probably have never heard of is called dual task. You mentioned this. So where we're doing two things at the same time, dual,
Yeah.
DUAL, we're engaging cognitively at the same time that we're engaging physically. And some people would push back and say, "Hey, I thought we were not supposed to multitask." But what
Yeah,
happens is that when we
right.
cognitively engage at the same time as physical engagement, this might mean walking and talking, or it might mean upping the
Mhm.
ante a bit more than that, depending on where you are on the spectrum of both cognitive capacity and physical capacity. But if we can, this is dynamic, it'll change over time, and
Yeah,
we have to stick with it so that we stay engaged. But when we do that, we get more benefits from the time we spend exercising.
yeah,
So this is just a nice way in my mind that a lot of people haven't heard of to optimize the time spent doing the work.
yeah,
You just get more benefit from
yeah.
it.
Yeah, it does make such a big difference, and I love that you said, like, walking and talking. People forget that that's an option, right?
It can be
A lot of
very
time
simple.
yeah. I used to have my, I'm also a CrossFit coach, because my mom had Lewy body dementia, and no one was helping her with, I mean, we went to all the places, but with her movement, and I was like, "I guess I need to figure this out." Anyways, I a lot of times have people, depending on their cognition and everything, if it's safe, if you're walking together, you can have a ball and just pass it to each other, and then you can chat a little bit and so there's so many ways to make it be a little bit fun. And then if you're walking, get the sunlight, which is really important for your circadian rhythm and all that kind of stuff. So,
Yeah,
yeah,
you can go to classes, right? A yoga,
yeah,
Pilates, Zumba, ballroom dancing, any of the classes where you're cued by an instructor or
yep,
you have to memorize the steps.
hmm,
You've got to like figure out how to get your left. Is it my left, my right,
yeah,
what, up, down, back, forward? That kind of thing is really helpful because you're engaged at the same time. And it can also be socially engaging if you meet friends there or you start,
yeah,
you either meet friends you already have or you make new friends. So there's social engagement, there's the music that can be engaging. There's lots of different ways to basically do this and not have it be overly complicated.
right,
I had a patient, it was really neat to see. She had her granddaughter who was in nursing school and interested in wellness and health. And she came to her visits with her for a while she was living with her temporarily. And she would take her out on walks. And at first, what they would do, her grandma, who was my patient, was an avid exerciser. So
hmm,
it wasn't like the walking was new. She did lots of hills, she walked quickly. But when her granddaughter started going with her, they started doing these dual task exercises and she would kind of
yeah,
quiz her. And they started with, birthdays of her kids,
hmm,
something that was emotionally
yeah,
interesting to her. So it was like anniversaries, birthdays, holidays, that kind of thing. And she would tell stories and kind of reminisce. And then as she got cognitively better, they started naming all the neighbors in the neighborhood, right? So who lives in
yeah,
that house? Like, teach me who lives in the houses. And then as she kept getting better, it was like, all right, let's do some math problems. Let's identify the trees and let's identify the birds. And then they went to like the Latin names of the trees and the birds, right? So they
such a
just
good
kept kind
idea.
of changing what she was engaging in and what she
Yeah,
was memorizing or trying to, working on. And that it was really just this like beautiful thing to
hmm,
witness of how they
yeah,
worked together. They made it fun, they made it enjoyable. And it was kind of sad because the granddaughter ended up moving out. And so she wasn't cooking for her. She wasn't doing the walks with her. And sure enough, her cognition went down.
yeah. It does. Yeah, it does make such a big difference. And I guess on that, like, when people, it is hard to do on your own. And I know you said have support, but what kind of team do you feel like is important to have for you?
Yeah.
Because, we know that somebody that does have cognitive decline probably can't implement a lot of things on their own in the beginning until it gets better. You know,
It's
what
interesting,
kinds,
Katie, because I've seen both, right?
yeah,
So there's this woman came into my office a year and a half ago or so. It was November, yeah, November of 2022. And so they went into holidays. Her MoCA score was an 8, so significant
yeah,
cognitive decline. And during that holiday, she had been this hostess who had, dresses up and like has 20, 30 people over for Christmas and buys all the kids the gifts and
yeah.
does all of the stuff, right? And in Christmas of 2022 was really sad for them. Like, she was not present. She was dejected and in the corner. She wasn't
Oh,
engaging. Everyone was really sad. And when she came in with her family, I was so impressed because she had 2 daughters, she still has them, 2
Yeah.
daughters and this husband, and I always tell people it was like watching a game of volleyball, like bump set spike.
Yep.
It was like one daughter would be like, "Okay, I'll make the appointment. Can you," and then point to the other daughter, "Can you take her? Dad, can you make sure that if she comes home and there's something that she needs to take, can you put it in the pill boxes and she can and do this and that?"
Yeah.
And it was just like, and they were all like
Aw.
laughing and like, haha, I can't do that on a Monday. You know what my Mondays are like. And that,
Yeah.
they just were like, they were so collaborative and they were having so much fun and they knew what mom liked. Like it was even like, oh, mom, afterwards we'll go get you a new pair of shoes because she's really into
Yep.
another one who's really into fashion and like looking good. And it was just so sweet to watch them. And sure enough, a year later, I saw them this past January 2024. So they got through another holiday season. And they
Nice.
were like, "You would not believe it."
Aw.
They were one of those families. I got my mom back. And even the cousins were like, "Oh my gosh, your mom, she did all the shopping and she got the kids like appropriate, age appropriate gifts. And she cooked
Aw.
her famous dessert. And like she was back, she was
Yeah.
engaged in the way that she had been before. And it was so incredible for them to watch. She had a mocha of 8.
I know
She
that's
has now a mocha of 15 on her
oh my
most
gosh.
recent, so nearly doubled it.
Yeah.
And her CPAP, we, found obstructive sleep apnea and
Love the
treated it.
CPAP.
Yeah, I did. Oh my god, don't leave that one out.
I know.
Um, I think that was a big part of it. We did all the other things too, so that wasn't the only thing, but
Mhm.
she improved dramatically, and I didn't have a ton of confidence because she had this pretty progressed, disease stage. She was at a
Yeah.
MoCA of 8, and what what I think that yes, the CPAP of course helped, but that support she got from her
Yep.
family, they were all in. They were all collaborating. They were all supporting her. They all wanted her back and she wanted to be back.
Yeah.
And that is what made the difference. Now, that being said, I have another story of a woman who joined our clinical trial and she showed up because she had measurable cognitive impairment. She had, I think, a
Mhm.
MoCA of 20 the
Okay.
day she showed up, and she had lost her husband. She had no kids. Her older siblings had passed away, so she was the only kind of living first degree relative, right?
Yeah.
Nobody else to take care of her. She had second cousins, I think, like they were pretty distant relatives living a couple hours north in a community, a senior living community that was designed to age in place. So, in
Yep.
order to be eligible to move in, you could lock in your rate, but you couldn't have any measurable cognitive impairment because it's so expensive to care
Yeah.
for someone with memory decline. So, you couldn't be at risk for needing that. You
Mhm.
had to have perfect cognitive function to buy into this place.
Yeah.
So, here she was feeling terrified that she was going to grow old, alone, demented, away
Right.
from the only family that she still had.
Yeah.
And she showed up and joined our trial because she was desperate, like absolutely desperate. Like if you think of someone needing their hand held to get through this process, she was like both hands held.
Yeah.
She was calling us every day. On Monday, my staff had to literally put aside time to like listen to all of
Her
the
message.
voicemails she'd left over the weekend, right?
Yeah.
Very scared and understandably so.
Mhm.
Well, 6 months later, her MoCA score is, like, back up to 28. She is, like, cooking for herself. She's off
Yeah.
the sugar. She's lost weight. She comes into the office, and she's, like, twirling around in her favorite dress that she hasn't worn in 10 years because she's, like, looking good, feeling
Yeah.
good. She's out dating. She has no interest in senior living anymore. She got her
Yeah.
taxes done. She got her yard cleaned up and her house cleaned up. Oh, and by the way, her neighbor got cancer in the middle of her
Oh.
six-month intervention, and she made it her process about helping him. She started
Yeah.
cooking not only for herself, but for him. Now she was totally overwhelmed, totally alone.
Yeah.
And she found a way to do it and to
Yeah.
get so it's like, yeah, we had a health coach who was working with us at that time and she called me. She like reached out specifically to be like, hey, this patient that we just recruited into the trial, I don't think that we can help her because she's in such a her readiness score is like
Yeah.
a generous 2 out of 10.
Yeah.
And then she showed us, like, this happens to me over and over again. Like, patients are the ones who show me what's possible.
Right.
So, do I have more confidence when you have this great team of people and providers and you have all the resources in the world? Yeah, it's a little easier. And yet, there are people who make it work
Right.
under lots of circumstances. So
Yeah.
don't let it scare you away if you don't have the perfect daughter-in-law who's like dropping everything to do all of this for you.
Yeah. Those are both such great stories. And, I do think it is really important to remember that there are so many people that figure it out. I also think it's so great that she felt comfortable calling you that many times, like, because it means that she, knew, okay, I need some support, and like, and I'm gonna
Mhm.
get this done, right? And she did. And that's such an amazing story, um, about going through that process, even when you don't have somebody, immediate family with you.
Yeah,
So
it's definitely possible to do. And
mhm.
I I'm a physician, right? I'm a naturopathic doctor and um I value the testing and I value the
Yeah.
data. And you don't need it.
Yeah.
So many people get better without ever doing that.
Hmm.
And it's because they do the foundational pieces. And
Right.
in fact, I would even say to people, don't worry about spending money on all that extra stuff
Yeah.
until like start with the diet, start with the exercise, start with the sleep, start with the stress management practice. There's so much good data on those things are more effective than medications.
Yeah.
And they help, and then when you start stacking them on top of each other, you get even more benefit. So just get started. Just get
Right. I know. I love your approach to that because I know that in the past, and I know that also studies on this are difficult to do. Well, my dad's a doctor, and doctors' families are always like, "Where's your double blind study on?" But it doesn't quite work that way, especially in lifestyle change studies. And before, I think people often felt like, "Oh, I need all of these supplements and I need all of these things, and it's going to be so expensive." And I love how you've shown us so consistently these foundational changes that can really make such a huge difference. And then if you still need something, then you can look at these other options, but if they might need to be added in, but you really start with the foundation first, which I think is really helpful and brings like a lot of hope to people. And also like, okay, I can do this thing. I can at least, I can try to change my sleep, or, go be with some friends and things like that. That's so important. What's the message we're missing as to why these things work, I guess? Or, everything's all about you have plaques in your brain, and
yeah.
then, that means you have dementia, which we know there's tons of people that have lots of plaques in their brain and don't have dementia. What's the message that we're kind of missing, I think, in what we're
Sure.
learning?
Yeah, yeah. I think it's time for a paradigm shift. And
Yeah.
let's give this a framework because it's such a great question. And you even mentioned like my dad's a doctor. Where's the double blind placebo controlled trial?
Yeah.
Right. So double blind placebo controlled trial really works if we have a simple intervention, a
Yep.
single molecule intervention, and we're all about reducing the variables. Right. And this is a very simple, what we're trying to do is simplify everything. And really, it's a reductionistic perspective,
Hmm.
which is helpful in some cases.
Yeah.
It's not like if you have a urinary tract infection and you need an antibiotic and we want to test if that antibiotic works versus this one, or if we want
Yeah.
to, reduce the variable, if we want your cholesterol to go down and we want to test different statins, by all means, the single molecule intervention makes a lot of sense. We control the other variables, see what happens. We get big studies and lots of funding because there's a pharmaceutical that can be patented and then we can charge the insurance and we can make all that money back.
Yeah.
So there's a formula for that.
Hmm.
Now, in dementia and Alzheimer's, dementia is the umbrella term that includes Alzheimer's. Dementia is this age associated memory loss or cognitive decline. And then Alzheimer's gets characterized by these amyloid plaques or tau proteins. These misfolded proteins are what we sometimes see. When we think of a complex system like the brain, take my houseplant here. If my houseplant is struggling, I don't think like, oh, it's misfolded proteins. Right? I
Yeah.
think, does it have enough water? Is it getting enough sunlight? Does it have too much water? Does it
Hmm.
have, are there toxins in the soil? Does it have enough nutrients in the soil? There's something that has impacted the function of this complex system, in this case, a plant, or in our general conversation here, it's the brain.
Hmm.
So when we think about what's causing dysfunction in the brain, what we want to do is apply these concepts, system science approaches or ideas to this, right? Which is dysregulation. What's going to cause
Hmm.
dysregulation? Imbalance, too much, too little, in the wrong place, at the wrong time. And so if we have dysregulation, imbalances, this leads to dis-ease.
Yeah.
Now, that is what can happen is like in that pathway, right? It triggers the production of misfolded proteins, but it's not the fault of the
Yeah.
misfolded proteins. In fact, we've learned that amyloid is there, it's
To help.
antimicrobial. It's there to
Yeah.
help. It's there to protect our brain. And so we want to go upstream and say, what is out of balance that is causing this disease process to be initiated? And what we find is that it's toxins, too much, too little, in the wrong place at the wrong time.
Yeah.
Nutrients, glucose and metabolism. So type 3 diabetes is one of the ways that we refer to Alzheimer's, right? It's when we
Hmm.
have glycotoxicity, too much sugar in the brain that can lead to a degradation of the cells. Or we might not have enough B12, methylated B vitamins to help us bring down homocysteine, which is an inflammatory marker, right? And we can
Yeah.
play this out in over lots of zinc and copper ratios and all kinds
Hmm.
of things. Amino acids, there's many, many nutrients that we would want to consider.
Yeah.
Then infections can trigger amyloid plaques and inflammation
Yeah.
generally, especially P. gingivalis, which is associated with gingivitis, herpes simplex 1 virus, especially a little bit more than herpes simplex 2. But the herpes viruses, COVID, Lyme spirochetes,
Yeah.
these are a handful of infections that specifically trigger and have been associated with amyloid plaque deposition in the brain. And then stress, we talk about exercise,
Yeah.
sleep deprivation, right? You can have too much stress, you can have too little stress. The stress of being a caregiver puts us at risk of
Hmm.
developing dementia,
Yeah.
especially if that has an impact on how we eat and
Yeah.
how much exercise we get and how much sleep we get
Right.
and all of the other things. But not, kicking our feet up and relaxing and not having meaning or purpose as we age is a way to have
Oh my.
too little stress
Yep.
that and support a cons basically like a const what am I trying to say? A container where
Yeah.
Alzheimer's can thrive. And then so we talked about toxins, nutrients, infections, stressors, and then structure. So genetics.
Hmm. Yeah.
Alzheimer's is associated with ApoE4, ApoE status, and ApoE4. One or two of them dramatically increases our risk of developing Alzheimer's. APP, amyloid precursor protein, and PSEN1 and 2. This can be associated with the early onset Alzheimer's, much
Yeah.
more rare. But of course, there can be genetic components. If we get hit over the head, this
Yeah.
can cause inflammation. If our airway is obstructed, this can cause a cognitive decline. So, thinking through the structural components, thinking through the signaling components, estrogen drops. Many women will notice that when
Yeah.
menopause hits, their cognition isn't as good, their sleep isn't as good. So, those signaling inputs that we talked about with exercise, the exerkines, do we have enough of the signals going to our brain to say, build more, create new? Or are the signals saying, no, protect, defend, reduce, like
Right.
contract? And what we want to do is flip the signaling towards create new, regenerate, heal.
Yeah.
So that's like when we think about what's supporting our complex system, our plan,
Yeah.
right? We want to systematically go through instead of saying, oh, just take out the proteins, these misfolded proteins. We say, okay, no, let's take a step back
Yeah.
and really look at what are the inputs that are causing dysregulation in this individual. So what
Hmm.
we want to do is take a more sophisticated approach. It's not about a single molecule. There's not one cause of this disease. There's multiple pathways that different people are going to take. And when we understand what risk factors, what pathways that individual has taken, we can go backwards. We can heal those things and then expect potentially, depending on, where we are and how far along the disease progression has gotten, potentially we can reverse that and get a recovery of function.
Hmm. That's such a good way to put it. I think it's because it does get confusing for people. It is a multi-system, and I know in our medical field we specialize a lot, which obviously is needed, right? Because some
Yeah.
things you need a specialist, in this one area. How it all works together is so important, and particularly for this disease. And the other thing that I love about this approach. I think we've underestimated because in dementia care, it's always when people are like, somebody's wandering or hitting or whatever, that's dementia, right? And we've started to say someone's forgetting, that's dementia. But why is the symptom happening? Why is this thing happening? And can we put in a support to fix that problem, or improve it depending on what's going on. So I feel like we've simplified dementia for a really long time in a way that's kind of been unhelpful to us.
I agree. And I love this combination of the medical perspective with, Montessori or Teepa Snow's work, kind of talking about being curious.
Yeah.
Like, what's the why? Why is this behavior happening? And is there an unmet need? There's probably something driving this,
Yeah.
because when we behave differently, when we interact differently, when there's different foods available, when they are better rested, we get a different outcome. And so
Yeah.
how can we create an environment? How can we create what's necessary to support this human being in the state that they're in, where they're very, very sensitive and things can go awry easily? How can we support them so that things stay on track?
Yeah.
And just having a curiosity rather than giving up and just saying, oh, well, they have this disease, and so there's nothing we can do.
Right.
Right. That's a cop out at this point.
It
We
is.
know enough.
I know. Yeah. Now yeah, definitely know enough. And it is really sad. I can't believe still I have clients who are like, yeah, I just went to the doctor. Like, even for one of my family members, they were like, yeah, you don't need to come back anymore. Your MoCA score is low enough. We don't need to see you anymore. And I was like, why is this happening?
It's changing.
I
It's
know.
changing.
I think, yeah, the stuff with that Sanjay Gupta just did, I was like, oh my gosh, this might actually like be a thing. Like,
This is the
uh,
moment.
yeah,
I'm like, yay, it's there. And then here, just read the book. That's the
I
how
know.
to.
See, just read the book. Now there's so many places to reference, like even in mainstream media now, there are more ways to reference like that this is working for a lot of people. One of the things that I really liked is the mantra that you developed, which is connection over correction. And I was wondering if you could talk about that a little bit, because I just love it.
Yeah, and I want to start by saying, like, I'm not perfect with this, or am I like the expert here, but it's something that I've watched over and over again with my patients, with Marama residents,
Hmm.
and that I aspire to, right? Is
Yeah.
that what we were just talking about with Teepa Snow, like getting curious and also meeting people where they're at.
Yeah.
So I had this example a week or two ago. I was at Marama having dinner with the residents, and there was a gentleman there, a doctor who I'm really excited to collaborate with. And I wanted him to be impressed. I wanted him to feel comfortable. And one of the residents didn't recognize who I was. And I met her many times, and she has dementia.
Yeah.
And so she was like, "Oh, I don't think we've met." And I was like started correcting her.
Yeah.
And throughout the conversation, I kept kind of saying things to try to remind her who I was. And it was totally about my pride
Yeah.
and my ego. And totally, it was like about me, not about connecting with her.
Yeah.
And in retrospect, it's like I teach this stuff
I
and it's
know.
still hard for me, right?
It
And so I
is.
want to just like start the conversation by saying, like, when when we have these, like, at least we can start to catch ourselves, and at
Yeah.
least we can, like, that's why the mantra is so helpful for me. Connection over correction. And when I left, like, as soon as I drove away, I was like, oh my God, connection over correction. What was I
I
doing?
know.
But I have another chance the next time, right?
Yeah.
And with dementia, at least, we get that second
Yeah.
chance. We get to try again. And what I wish I had done was when she said, "Oh, I don't think we've met," I wish I had been like, "Oh, I'm Dr. Heather Sandison. I'm so glad you're here. Tell me about you."
Yeah.
And just really lean into connecting, because what happened was that when I started making her wrong, when I started trying to correct her, now she's stressed.
Yeah.
Now she feels wrong. Now she's not comfortable.
Yeah.
And really, when we can connect, now people are having fun. Now they're more engaged. Now they're more likely to talk. Now they're more open to learning.
Yeah.
And when we have, like, we can diffuse situations when we lean into their world,
Yeah.
when we just accept where they are and we don't look to correct.
Yeah.
Now, this is true with my 5-year-old daughter. This is
Mhm.
true with my partner. This
Yeah,
is
I am
true
right for
with
everything.
any any relationship, right? Uh,
Yeah.
and it particularly when we're trying to create an environment where our dementia loved one is thriving, where they're
Yeah.
shining,
Right.
um, is focusing really, and it's the knee-jerk reaction is to correct them.
I know.
But if we can retrain ourselves to just connect, because it
Yeah.
doesn't really matter.
I know.
No,
But
a lot
yeah.
of these things don't matter.
The other thing that I loved about the way you explain things and the way the book is written, it's here's all these lifestyle things, all these factors that you want to look at and what you could do, to help your loved one improve or for, yourself. But it also does bring in the day-to-day care stuff. But day to day, how do you also communicate with each other? How do you actually, be with each other? How do you support somebody's joy and connection and all that kind of stuff? I think that's so important to balance the two because even all the lifestyle changes, often we call them interventions, that's not the only thing that you need. And people still are having, depending on how much they are able to reverse, they may still have some issues with their brain function that we still need to care for that part of them as well while we're also helping them improve as much as possible. So I love that you do both. I hadn't really seen that in many places. And I think that's amazing, and also with Marama, I was wondering if you could just talk about a little bit about what you do there and what your hopes are for Marama and for, the book going forward.
Yeah. So Marama was created because of talking to particularly women in the sandwich generation, where
Yeah.
they're like, I got a full time job, I got kids to raise, and my parents need help, or my mom needs help, or my uncle, needs help. They've got dementia.
Yeah.
And I get it. I get what Dr. Bredesen's saying. I understand it intellectually. But the thought of having them move in here and then
Yeah.
taking on this more than full time job, it's just not, it's beyond my
Yeah.
capacity. And so where can I send them? And when I looked into this, there was no place that was really offering a true immersive experience in Dr. Bredesen's approach. And so that was why we created Marama. And I feel super fortunate to have had just the privilege of doing it, of creating it. It's like it's an experiment, right? Of like, what's going to happen? And last April, we got to open our second facility in Kansas. And the first 5 residents have been there more than 6 months, and I think, like, we even have a new set of d I just got the email this morning, there's, like, new MoCA scores, and the first 5 residents, 4 of them improved in 6 months.
That's amazing.
So, more often than not, when we give people the resource, when their brain gets the support it needs, they do improve. Now, I wanna come back, there was, something you mentioned just, like, about the communication, and one of the stories that I see play out over and over again is typically it's women, but it can be men too that come in and they've read Dr. Bredesen's book and they're like, my mom needs this, but my brother is super conventional and is totally
Yes.
against it. And my sister is worried about her inheritance, so it doesn't feel like we should spend the money. And I feel like I'm the only one that wants the best thing for mom. How do I convince them? And there are so many different family dynamics that come up. There are times when it's appropriate to push really hard for this, and there are times when it's not. And I really that's part of what we talk about a little bit in the book is like how do get, of course, yeah, I would love for you to give the book to a loved one of yours who's not convinced and hope and send the CNN articles and do what you can. But if they're just really not into it, like, don't ruin your relationship with your siblings or your
Right.
kids over this.
Yeah.
Take the enthusiasm and turn it back towards your health.
Yeah.
Start doing the exercise for you, particularly if you're genetically related to whoever is suffering. If you can't get everybody else on board and they're resistant, focus on you. Focus on diet and exercise and sleep and stress management. And if you've got resources, go get the labs tested and make sure that you are preventing cognitive decline for yourself because it's so hard to watch someone feel so angry and so helpless and like all the bad stuff
Yeah.
when you're stuck in that situation where you can't get everyone on board. And I really hope, I mean, this is part of why I'm so excited about the narrative changing is because I think
Yes.
it will bring more people on board and
Yeah.
they'll get access and the benefit of this. But if you
Right.
feel like you're fighting, it's okay. It's
Yeah.
okay to shift focus onto you.
Yeah. So much about the process of dementia care and all the things is learning to let go and that there's so much we can't control. Like I get the same question all the time. How do I make my loved one have a care partner? Can like hire somebody? How do I get my siblings on board with us changing these things? We can't force anybody to do that, to do anything. And it's the same, our brains are more similar than we think that they are. We think we're different. and people with dementia have a deficit, and that means we're so different. But any of us, if it's something that we don't feel safe doing, we will all say no. And
Mhm.
so, the only thing that we can do is kind of let go and know we can't control things, and that even though that means sometimes the outcomes we're not going to like, right? We wish we could save people. Honestly, we wish we could help everybody. Let go and then just build trust, is where you can, because
Mhm.
over time somebody might be like, "Oh, can I see that book again?" Or, I noticed like you're doing all these things and you seem happier or
Be the
better, or,
model. Yeah.
you can do more things. You want to tell me a little bit more about what you're doing? So that's so hard though, the letting go kind of thing, because
So
we just want to help
hard.
everybody.
Yeah, and we're so attached, right? It's part of
Yeah,
the grief
it
process.
is. Yeah.
Um, and when we see it, it feels like an injustice, right? It's like I see
Yeah.
that there's this thing we could do for mom, but we're not doing it.
Yeah.
And so it's like do what you can, and then that learning to let go and refocus the energy on supporting your own cognition. That's what you
Right.
have. We only have control over ourselves and what
Yeah.
we can do. And so I think that there are so many families who just have impossible decisions to make, right?
Yeah.
Like there was a recent article about antipsychotics and
Yeah.
how bad they are for people with dementia and how they lead to increase all cause mortality.
Yeah.
And yet it can be impossible to find a caregiver
Right.
if they're being combative and
Yeah.
aggressive. And so there are these really impossible decisions, financial decisions. I mean, Katie Engelhart, I don't know if you've read any of her work,
Yeah.
but she wrote a book called The Inevitable, and she's been
Mhm.
published widely around dementia. And,
Yeah.
from a societal perspective, we have all this aging population in the prison system, and many of them are experiencing dementia.
Yeah.
What do we do? Like it's costly to care for them. They've been in the system for a long time. Being incarcerated increases your aging rate. I mean, there
Yeah.
are at societal levels, at family dynamic levels, there are so many tough conversations to have. And for each family, there is not one right answer.
Yeah.
And so navigating this, reaching out, finding community, finding support, focusing on your own health when you don't have control of everyone else's. These are just a couple things that I recommend, but also just knowing like you're not alone.
Yeah.
You're not alone in these really hard decisions, and that there's just often not a right way. So do
I
what's
know.
best for you and your mental health and your physical health.
I know. Yeah. I mean, I know everybody wants the answer, but every situation is different, and you have whatever decision you've made is the right one for you. Sometimes I think about my mom or even my dad, and I think if there is like grief in that, if I could have had them do this, like, could it be different? And I mean, yeah, but not everything is within, your control and things like that. And so decisions, even when they're tough or not the ideal one you wish you could have made, they're still the right ones, because that was what was mentally, physically, emotionally safest and best for everybody involved. So and that's the best we can do.
Yep, and hopefully for our generation, Alzheimer's becomes optional. We know
I know.
enough, we're learning more all the time, the research is expanding, the word's getting out. And so, thank you for being with me on this
Mhm.
journey of like trying to shift things for people that come after you and your family.
Yeah, thank you so much for doing this, and I mean, when I heard you created Marama, I was like, I can't, like, that's what I had wished somebody would create. And, now we have it. And now with your book, which comes out June 11th, which is so exciting. And I think it's going to help lots of people. And it's so accessible, I think, and compassionate and well researched. Like, I love everything that you've done, with the book. I think it's going to help a lot of people, um, with their loved one, or even just, with their own brain health. And yes, I think about it a lot. What if I get dementia and I do have one of the genes? And so I look at Jeffrey sometimes and I think about it and I'm like, but no, what if it's optional? What if it is optional when I'm older? Well, I mean, I'm 45. There's lots of people that get early onset dementia at my age, more and more. So
But you have all the tools.
I
You have the
know,
tools to, at
right?
the very least,
Yeah.
delay, inevitably, hopefully.
Yes. Yeah. And now we have this additional tool with your book. I'm so excited that people get to learn more about what you do and have this resource for them and their families. So thank you for everything that you do. I don't know how you do it all, and you got a kiddo. I don't
I
know how
have
you
a
do it all,
great
but thank you,
team.
thank you.
It's all about teams, right?
Yeah,
Working together.
that's
Thank you
true.
so much for having me,
Oh,
Katie. It's just
thank
always a
you.
privilege to get to catch up with you, and you're so inspiring. And again, I'm just so grateful that you are here as a source of support to other people with your experience, having been in it, both suffering with cognitive decline and recovering, and from supporting two parents. So thank you for all that you were doing and for having me.
Oh, thank you so much. And we will chat again later, I'm sure. And
I hope so.
yeah, thank you so
So good to see
much.
you. Have an
Good to
awesome
see you.
weekend.
You
Enjoy your
too.
family. Bye.
Bye. Welcome to Creative Connections in Dementia Care. Today I'm going to be talking with Dr. Heather Sandison about her new book, Reversing Alzheimer's. And I'm so excited to talk with her this because the ways that we can actually Im- because the changes that we can make to help people reverse their Alzheimer's, or if they're really late. We're going to talk We're going to talk about real ways that people have seen improvements in their MoCA scores, which is one of the tests that they do to see how advanced somebody's dementia is. Um, how people have stopped their decline, actually reversed their decline, and gotten a lot of cognitive functioning back or their life back, and hear stories of how people have done that and some of the things that you can do to help your loved one as well as help yourself with your own brain health, so that you can hopefully prevent dementia. Then keep watching. And if you want to learn about how all of us at any age can live a brain healthy lifestyle, and so that dementia can be, and so that hopefully in the future dementia is optional, then keep watching. A little bit about Dr. Sandison. She is a renowned naturopathic doctor, and she specializes in neurocognitive medicine. She's the founder of Solcere Clinic. She's the founder of Solcere Clinic, which is a brain health optimization clinic. And she is also the founder of Marama, which is a memory care facility that uses her pro. And she is also the founder of Marama, which is the first memory care facility where their goal is for people to actually move out and hopefully live independently again or with their families. And in this interview, we talk about some of the things that have been missing in the conversation around what causes dementia and what can help somebody with dementia improve, and how this is actually happening for people on a daily basis. Thanks so much for joining me. Thanks so much for joining me today. And thanks so much for joining me thanks so much for joining me today. If you like this video and you want more content like this about brain health, and also if you're caring for a loved one with dementia, about how to do daily care with your loved one so that you both can have more connection and more joy, then please hit the subscribe button.